Today, on April 26th, 2015, I'll be presenting on nursing issues in the Nepali culture. The goal of this presentation is to give cultural background on the Nepali and help nurses to anticipate health concerns for this population, as well as to identify key nursing considerations when providing culturally competent care. Who are the Nepali? Nepal is a country situated between China and India. Its culture is rich, but it struggles with conflict resulting from complex geographical struggles and political dissent. The primary religions in Nepal are Hinduism and Buddhism. It has a varied geography and is most known for Mount Everest. From the Hindu tradition, a medical system known as Ayurveda is prevalent in Nepal. The health culture of Nepal. The Nepali culture, while diverse, struggles universally with several health factors. Of note, the family unit of Nepal is changing. The quote, living arrangements and familial responsibilities that once centered around or within the family networks are changing to look more like Western, individualistic systems, unquote. Nepal's unique geography creates daily havocs not experienced by most Americans, and they can have crippling effects on economy and psychological health. As you may have heard just yesterday, a 7.8 magnitude earthquake devastated Nepal, the biggest earthquake in the region since 1934. Earthquakes are not a rare occurrence in Nepal. Even though its epicenter was near a particularly urban area, the medical and emergency infrastructure of the country is being tested. Finally, due to the geographical and economic limitations, traditional healing practices overtake formalized healthcare, leading to continued issues with simple diseases such as diarrhea, nutrition, and women's health issues. Childbearing women and pregnancy in Nepal. Childbearing comes with considerable risks in Nepal. According to New Pain and Nauru, 2014, quote, evidence suggests that a significant proportion of neonatal morbidity and mortality in developing countries can be prevented through low-cost interventions during pregnancy, delivery, and postnatal period, unquote. Due to the poverty, illiteracy, and geographical barriers present in Nepal, these interventions are lacking. Many women in Nepal give birth at home, and, quote, many women who give birth in facilities are discharged within hours after childbirth, without any indication where they can obtain further care or support, unquote. Women are not active participants in routine cervical screenings. The delay in seeking treatment, quote, may have resulted due to the influence of patients' characteristics, such as high level of illiteracy, poor health awareness, poor economic condition, their problematic health-seeking behavior, ignoring the mild gynecological symptoms, as well as dependency on traditional health practices, unquote. What this means for you, a nurse in the U.S. caring for a woman from Nepal, is that your patient may present with high levels of health literacy. As such, you, the nurse, will need to perform diligent education about the importance of routine health screenings, as well as consistent well-woman exams, which include cervical cancer screenings and perinatal care. You may also anticipate working against traditional healing practices that these women may cling to. Childhood, nutrition, and diarrhea. According to a 2013 study, quote, childhood diarrhea is one of the major causes of mortality and morbidity in Nepal, unquote. This study investigated the adherence to approved protocols of childhood diarrhea treatment in Nepal and found, quote, at baseline, less than 10% of the participants were adhering to the diarrhea treatment guidelines, unquote. In the U.S., childhood diarrhea, while a nuisance, is easily recognized and treated by most families, and widely available urgent cares, minute clinics, primary cares, and even emergency departments are armed with the tools needed to manage childhood diarrhea. The geographical, literacy, and financial barriers prevent many Nepalese people from obtaining satisfactory treatment for their children. The same study showed, quote, evidence of non-evidence-based prescriptions of antimicrobials, medicines affecting gastric motility, multivitamins, and enzyme-based preparations, unquote. Another fundamental issue in childhood health for the Nepali is malnutrition. While malnutrition is problematic across the lifespan, it's especially evident in children. According to a 2014 study, quote, nearly half of the children were underweight and stunted, unquote, in one rural region of Nepal. This comes from the relative lack of micronutrients in the common diets of the Nepali, which is highly reliant on a base of rice. When a Nepali person moves to America, they may bring their common dietary practices with them, leading to a continued pattern of malnutrition for their children. As the nurse of a Nepali family, it's your responsibility to provide practical and accurate education regarding nutrition and diarrhea management to your patient. This may include asking your family to fill out a sample meal diary and consulting a nutritionist to analyze for any nutritional gaps. Adults, psychosocial, and nutrition. As previously discussed, Nepal has high rates of poverty, illiteracy, and natural disasters. As such, the population is prone to psychological issues. The relative lack of services pertaining to mental health care and adherence to traditional remedies and health practices may be a barrier to psychosocial health. A 2012 study discussed that, quote, poor economic performance, entrenched caste, ethnic and gender-based discrimination, and social marginalization, ongoing communal violence or conflict, lack of infrastructure, and the high frequency of recurring emergencies from natural events, i.e. floods, landslides, earthquakes, have resulted in recurrent humanitarian needs, unquote. The Nepali people operate under a type of stress unknown to many of us. If they have moved to the U.S., their struggles may not register with the many healthcare providers. It's important to screen these individuals for symptoms of anxiety and other psychological strains resultant from their experience in Nepal. As we know from Maslow's hierarchy of needs, safety is paramount to well-being. As in any society, especially one with enmeshed gender discrimination carried over from history, intimate partner violence is a problem in Nepali culture. A 2014 study found that while 79.4% of couples reported no physical intimate partner violence towards their wives, only 4.9% of couples reported the same level of lifetime occurrence of physical intimate partner violence. In other words, women admitted to more physical intimate partner violence than their husbands. The research also cited that, quote, women's status is still low, as is reflected in their literacy rate, maternal mortality ratio, and Nepal's rank in the Human Development Index, unquote. While institutionalized discrimination against women is not formal, there is an incidental data to support the fact that women are inferior to men in overall well-being. Also, as mentioned in the discussion of children, nutrition continues to be problematic for Nepali adults. The diet of especially rural Nepali is high in rice, with small amounts of protein and other nutrients. As such, many of the Nepali are highly nutrient deficient, especially in protein, vitamin A, iron, riboflavin, and selenium. As the nurse, you should build rapport with your client in order to screen for psychosocial issues, including but not limited to anxiety and intimate partner violence. Furthermore, you should analyze their diets and complete metabolic panels to screen for nutrient deficiencies. You may require a great deal of education regarding each of these factors in order to obtain compliance with interventions, especially diet changes. Abandonment in older adults. The social structure of Nepal is changing. While change brings many positive social factors to Nepal, such as increasing gender equality, increases in education, and improvements in fields such as medicine, it also disrupts the traditional values of the region. Nepal is westernizing, and with its westernization comes a decreased emphasis on family relationships and increased emphasis on individualism and personal success. Yarger and Brownell-Otto, 2014, devoted their research to the changing family dynamics in Nepal. They identified several challenges facing older adults as society westernizes and individualism overtakes family. They found that, quote, custom no longer compels young people to provide for their older parents or relatives, so their support is increasingly dependent on personal sentiments, such as sympathy or affection, unquote. This leaves older adults in a potentially threatening situation. Their assumed safety with their children is less sure, and as such, older adults are struggling to provide for themselves. This phenomena is particularly profound in the urban areas, and that, quote, individuals who had more education or who had traveled to Kathmandu or outside Nepal were less likely to believe that a married child should care for his or her aging parents, unquote. For you, the nurse, it's important to distinguish the individual family structure of your client. While they may hold to traditional family structure and cohabitate with their aging parents, the older Nepali may struggle with feeling like a burden to their child, who in previous generations would have been compelled by culture to care for their aging parent. Ensuring the support and well-being of your older Nepali client is essential. Community and Nepali culture. As you can see from the discussions across the lifespan, community in Nepal is varied according to religion, geographical location, and socioeconomic status. The urban areas are trying to quickly westernize, which means more business and education, as well as greater equality between genders. However, with this evolution, the traditional family structure is threatened. Older adults are the most at risk as Nepali culture moves away from the traditional family structure. Caring for your Nepali patient, a summary. I hope that from this presentation, you've gained insight into the unique and complex issues facing the people of Nepal. Should you have the opportunity to care for one of these individuals, consider the potential attributes their culture may contribute to their care. With yesterday's earthquake making headlines, hopefully you can understand that your patient may have experience with natural disasters. Women may need in-depth information regarding gynecological health and perinatal care. Children and adults alike may struggle with meeting nutritional needs. Adults may be prone to psychological disturbances, uncommon to those of us fortunate enough to avoid natural disasters. Older adults may be vulnerable as the community shifts from a family model to a more individualistic model. Most importantly, remember that each individual is unique and that they may wear their culture in both expected and unexpected ways. Each Nepali comes to America for a different reason, and that reason may give a clue as to their personal views on health. As a Nepali patient I cared for yesterday said, quote, I came to Nepal for my children, my family. If this had happened to me there, I would be dead, unquote. As a personal note, if you'd like to donate to support the efforts to rebuild Nepal after their recent earthquake yesterday, please visit one of the following sites, CARE or Mercy Corps. This is a list of my references. Thank you so much for listening and watching my presentation. I hope it's been illuminating for you. Thank you so much.